Hi, my name is Marcus. I'm now going to deliver a 30-minute PT program. Our client today is Raylene. She has been pre-screened. She is a low-risk client. However, we've identified that her BMI is 25.4 and her girth measurement is 81 centimetres. This means that Ray is at an increased risk of a cardiovascular disease or even diabetes. Ray has asked for a fat loss program. So today what we'll be doing is delivering a fat loss program and also increasing her lean muscle.
Okay, Ray, just going to increase the intensity. It is as close to our end of the warm-up. At the end of the warm-up, I want your heart rate needs to be at that exercise heart rate. And because we're doing a high intensity and because you're after a fat loss program today, that's why we're increasing the intensity on that high intensity. So I've increased the intensity and I'm just going to increase it a little bit more. Good work. And I'm just going to increase it a little bit more. I'll just get you to stand up and push through. Okay, I want you to push through your heels. You need to be bracing your abdomens. You need to squeeze through your scapula, your chest up, and deep breath in. It's going to keep you here for another minute until your heart rate is at the level that's required. Good work, doing well. So on a scale of 1 to 10, how's your intensity?
7 to 8.
About 7 to 8? Excellent. We've reached the intensity level that we require, so I'll get you to stop and we'll move on to the conditioning phase.
7, isn't it?
Okay, Ray, I want you to drop down into the squat position and then back up again. We're looking at doing 10 squats and then we'll move into the jumping lunges. I want you to push through your heels, keep your chest up and get your hips right down. Alright, crack on, get started. That's it, get those hips nice and down. Alright, how's the weight of the bar feel for you? That's good?
Thanks.
And a scale of 1 to 10 for your intensity, how do you feel?
About 7.
You're about a 7? That's good work. I'll get you to go down a little bit further. That's it. Think as though you're like you're sitting on a chair. Give me 3 more. Check your spine. 1 more. That's it, good work. Put the bar down. Let's move into the jumping lunges. I want you to do 10 per leg. Use those arms to really drive up. Brace your abs and drive through your heels. So crack on. See, you can put your hands on your hips. Making sure you go all the way down. That's it, drive up through your heels. 3, 2, 1. That's it, excellent, good work. Ray, this is still part of the conditioning phase, so it's going to turn the intensity up. I want you to try and get going as fast as you can. I want you to brace your abdomen, relax through your back, and basically drive through your heels. That's it, that's good. So how's your intensity?
7 to 8.
Okay, 7 to 8 is what it's good to start off with, but what we're going to try and do is want to be at the high end of the 9 or 10, around that 9 or 10 mark. So I want you to focus on your goals. I want you thinking of all the reasons why you're here today and use that while I'm increasing the intensity. So really focus and push it through. So I want you to suck it in and I want you to go stand up, really push through. I want you to breathe in. Then I want to breathe in and out through your nose. I want you to focus on those goals and really motivate you while you're here today. You're doing well, good work. So on a scale of 1 to 10, what
About 9.
about a 9? That's good. That's the intensity that we're after, around that 9 to 10. So just finish up there. We're going to now move on to the conditioning phase. So I'll get you to do the bent over row now. So pick up the weights. lean over and start get going. And you ensure you're bracing your abdomens. We want to do about 10 bent over rows. You want to squeeze through your scapula. Make sure you're squeezing through there. Remember, we identified the weakness in your lower traps, so this will help to correct that posture, imbalance that you've got. Really lock in those elbows, bring those elbows in. That's it. Give me 3, 2, 1. All right, put the weights down. We'll move on to the dumbbell push-ups. Yep, down on your knees. Remember, through the push-up, you want to brace your abdomens. You want a neutral spine, and you want to work. You'll be working those pec majors, and the front of the shoulders. So we'll give you 10. Just make sure those hips are up, so neutral spine. Yep, doing well. All the way down. Keep going. 3, 2, 1. That's it. Good work. Excellent. Okay, Ray, we're at our last minute of the PT session. So what I would like you to do is really push through those last 15 seconds. I can see you've got a bit of a sweat up and a bit of a puffing in your breathing. That's good. Keep pushing through for another 10 seconds. Really drive through your heels. Push a little more, push a little bit more. So on a scale of 1 to 10, how's your intensity?
10.
About a 10. That's good work. Slow down. Slow down. And I'll give you a drink. You can have a drink. Just slow down. Good work. Okay, what we're going to do now are crunches, and then we're going to roll over and do a plank at the end. So what I get you to do, Ray, is raise your knees, both of them together. Raise your knees up, which flattens out your back, your lower back, and also protect it. You can have your hands across your chest or behind your head in the crunch, and we're looking to do 8 crunches. So as you're coming up, breathe out, brace your abdomen. So you want to be bracing your abs, because we're working the rectus abdominis, so that 6-pack that you've got. All right, so we're working that. So we'll get started. Squeeze, making sure you squeeze those abs together. Just raise your legs up a bit. All right, give me another 3. Want to short change you, so another 1. Give me 1 more. Good work. Okay, let's roll over. We'll do the plank. So get down on your forearms. Both of your forearms. Raise up on your toes. I want you to squeeze through your scapula. So you'll be squeezing through your scapula. Have your hips nice and high. Yep, and brace through your abs, through your abdomen. Okay. I get you to hold it like that. Yep. Deep breathing. Keep your eyes up. Look forward. That's it. Doing well. Good work. Almost there. 5, 4, 3, 2, 1. Okay, rest. Okay, Ray, we're in the last minute of our cool down, so I want you to take it nice and easy. Obviously, during our conditioning phase, our heart rate was at that around that 90%, 9 out of 10. And now we're on the cool down phase. We want to gradually work that down, our heart rate down, back down to that around that 40%, around that 4 out of 10 mark. We want to do that gradually so we don't cause any injuries. So on a scale of 1 to 10, how do you think your intensity is at the moment? About a 5? That's good. So while I've got you here, I'm just going to ask for some feedback. Just record that down. In terms of the session and exercises, do you feel that you're working towards your goal of fat loss?
Yes.
In the program? So we're basically looking to improve your fitness. So, you know, fitter people burn the fat faster. That's what we're sort of aiming for. Would you like to change anything for next time?
No.
No? Did you actually enjoy the PT session program?
Yes, I did.
You did? Do you have any pain in your shoulders, your back, your knees, or your ankles, or anywhere?
No.
No pain? Okay, so on a scale of 1 to 10 again, how do you feel now?
3.
You got a 3? Okay, that's good. That's the end of the session there.